I did some voluntary work with HIV patients, and there was about 2 of them that the doctor was saying that it would have been such a great idea to take patients like that and study them. What is it? Because it's like they don't go into, they come back with, if they come to you and take their test, they leave saying, oh, I have no HIV, but they have it.
It's the same like if a person has a heart attack and you're doing an EKG. EKG is normal.
Yeah.
EKG doesn't show that you have a heart attack. Okay, so things happen.
The body is funny.
The body, yes, body is the own way. Okay, overuse of antibiotics. Okay, don't forget, we said antibiotics came from where? Fungus. Okay, so the base of antibiotic is a fungus. So even if they do some chemical stuff. So when you take antibiotic for the long time, so the fungus began to burst in your body. And you could have like a white spot in the tongue, you can see, or spot in your palate. Okay, especially if it's happening in the kids, you can see the tongue begin to have like that white stuff, right?
Flush.
Okay, so that's why if they told you have to take antibiotic for, let's say, 5 days, don't take it for 6 days, because you still have like a 30-day supply if you want to finish it off. No. Sometimes when you need to take, usually they don't give you more than 15 days.
Yeah, they're getting straight for that. Before they always give you a little bit extra, they're becoming real,
Yeah. So when they give you antibiotic for the long time period, they also give you medication. It's called antifungus medication that you take together with antibiotics. Like, for example, nystatin. I don't know if you heard about this. Okay, so you take because it will protect you from getting antibiotics. All right. So, what I want to say about antibiotics too, that they're supposed to begin to help you in about 3 days. Okay, you begin to take, doctor prescribes antibiotics, you begin to take it, you take 3, 4, 5 days, it's not helping. So what do you have to do? You have to stop taking it. Because your body is resisting to it. It's not for you have to go back to the doctor and tell him that it's not helping. But again, a lot of patients, they continue to take medication because doctor prescribed, let's say, for 10 days, and then after 10 days, you go back to the doctor, listen to, for example, lungs, you had pneumonia. I said, I don't understand. It's the same thing, like nothing happened. So if you don't see the result in 3 days, stop it. You or your kids, especially kids. Kids very sensitive, so they need to get help in a day.
Yeah.
Okay, if it's not, stop it right away. Okay, we have thousands and thousands of antibiotics. Really, it's very hard to remember the names, and open the door. Leave it open. Don't close it. Okay. Okay, we have thousands of different really antibiotics. Okay. Okay, so we cannot remember everything, but we don't need to remember everything. Okay, we have you remember we said about the desk book in a very doctor work medical stuff, whatever you need to look for the medication, medicine, it's fine. You go and look because a lot of times the patient will ask you to explain what is it taking, why is it taking. Okay, so but we have a few major groups of antibiotics, major groups of these antibiotics. Okay, And we start from the father of antibiotics, it's penicillin. Bless you.
God bless you.
Second one. It's coming back. Alright, so the penicillin group. Okay? Under each group, they showed you what kind of actions you can receive from this medication, how do you have to, or what is it using for, what kind of adverse reaction, and dosage and routes. Okay, so generally, okay, you have a tables on the page 214. Okay, you have a table. Okay, so you're going to have other tables right there during this chapter. On those tables, they show the groups of those antibiotics, what kind of other names instead of the group name of antibiotic existing, and how you have to administer them, either the orally or IVs. Okay, for example, let's look under penicillin. Okay, so generic name, you see they have like amoxicillin, ampicillin, penicillin G, penicillin B, okay, then piperacillin. Okay, so and you see how you have to, how to administer. If you see oral or if you see IM, it means they don't have a combination. They produce either orally or intramuscular. They have both ways. Okay? So, and you see they always give it to you adult dosage here and a children dosage. So this is actually type of the tables which you can look on those books, medication books I told you. Okay, that's topics. Then you can open and on alphabetical orders you will see antibiotics. What's on A, what's on B, what's on C, and you can see all this stuff which actually are on the tables. Okay, so you see, and they also give it to you like a special consideration. What does special consideration means? Special consideration means what's the special? How do you have to take them? For example, all the penicillin group. Okay, they tell you.